Welcome to the Cystic Fibrosis Foundation's CF Education Day webcast. Lung Transplantation, the Patient Perspective. I'm Melissa Chin, Clinical Program Specialist at the CF Foundation. This webcast is hosted by the CF Foundation and supported through an unrestricted educational grant from Genentech. To learn more about CF clinical research, CF lung health and disease, nutrition, germs and infection control, healthcare coverage, and more, watch an archived webcast on the CF Foundation's website. Joining me today is James Watson, an adult with CF and a lung transplant recipient, as well as Dr. Jennifer Taylor Kausar from the Adult CF Care Center at National Jewish Medical Center and the Assistant Professor in Denver, Colorado. Welcome, Jennifer and James.
Thanks.
So my first question is for you, James. Why don't you begin telling us a little about yourself?
I was diagnosed with cystic fibrosis at day one. Mostly healthy throughout adolescence, played a lot of sports, help with my lungs. Right now I'm 34. I've been post-transplant 6 years and 1 month. Fairly healthy. I play sports, hockey, racquetball, softball, skiing, snowboarding.
That's wonderful. Now, Jennifer, what should people know about being considered for a lung transplant?
I think the big things to remember is that you are trading one disease for another. There are absolutely benefits to getting lung transplant. For example, you'll most likely survive longer than you would have if you hadn't gotten a transplant. You'll feel a lot better, so you'll have more energy. You'll be able to do things that you weren't able to do for a very long time. Maybe go back to work, go back to school, just try to meet your dreams and your goals. You also will have to spend less time doing really complicated medical regimens. However, there is the risk that you would die sooner than if you had not gotten a transplant. And again, you're trading one disease for another, so there are chronic medicines that you have to take, and you can develop other chronic diseases such as diabetes. If you didn't have it before transplant, it'll definitely probably occur after transplant. You can also develop kidney disease, and some patients actually develop cancers related to the drugs that they're taking. And you still have CF throughout your body, as I'm sure James can tell you. So you still have to take your enzymes, you still have to worry about your bone health, those kind of things.
So what can people do to stay as healthy as possible?
Well, they really need to follow the direction of what their CF center is giving them to do with their medication. So they want to stay as healthy for as long as possible, because you want to do transplant as the last effort to save your life. You don't want to do that early, because if you do it too early, you could die again sooner than you would have if you hadn't. So you need to follow the direction of your transplant center, and I think that pulmonary rehab is another really important thing that most transplant centers will ask patients to do before transplant.
So you mentioned transplant is like trading one disease for another. What are the differences between caring for CF lung disease and then keeping a transplanted lung healthy?
Well, you're not going to have to do, in most cases, inhalers the way you did before. You're not going to be sitting at with a nebulizer for hours and hours. You're not going to be sitting with a vest for hours and hours. But you do, unlike with CF care, have to absolutely take your medicines every day at the right time of day, because if you don't, then you can develop rejection, which can damage the lungs to the point where they fail.
Now, James, what was it like when you were listed for transplant? Where were you when you heard this news that a lung was available?
For me, I was at the dinner with a friend. I had gotten pretty sick. My lungs had deteriorated quite a bit. I had not done as much activities that I like to do. I was still doing my vest, but I didn't do as much sporting activities because I physically couldn't. I had developed diabetes, which kind of brought my health down a little bit, but that diabetes also helped me qualify for transplant a lot sooner than if I didn't have it. But my lungs were down quite a bit, and just out with a friend for dinner and got the call, and it changed my life.
What was your FEV1 pre and post transplant?
Pre-transplant, it was about 29%, and then my first clinic after my transplant was 62%.
So how was that recovery? What was it like?
A lot of I had an exercise bike. I would do that, and I would do a lot of walking. It was just going along and just rehabbing and taking it slow, but still kind of pushing myself enough and getting out and being active and doing the right thing, like taking my medicines, every day at the exact same time, not missing a single dose, and just keeping the medicines going and following the doctor's orders, and then eventually getting up to where I could exercise more and, getting to that point.
Now, Jennifer, what James described, is that typical of what somebody who's gone through a lung transplant would experience?
Yeah, I think that's very typical. Initially, patients are usually in the hospital for a week or two, and then they're going to their transplant center once a week at most transplant centers for the first couple of months, and then it switches to monthly, and then you still follow up with your center very closely. But you pretty quickly can start to do the things that you hadn't been able to do in many years.
And how often should a person visit their CF care center versus seeing, their transplant doctor?
Well, their number one priority is to follow up with their transplant doctor and make sure that everything is going well with their transplant. But ideally, we would like to see them in CF clinic because, again, they still do have CF everywhere else in their body. And to manage their pancreatic insufficiency and help manage their diabetes and their bone health, we really like to try to stay involved. It's hard for the patients, though, because it's a lot of appointments, especially in the beginning.
Yeah. A commonly asked question we get is, what is the prognosis for somebody with being considered for a CF lung transplant?
Well, across the board, if you look at the survival for patients who get lung transplants, it's about 50% at 5 years. Fortunately, CF patients actually usually do better than the average patient who gets a lung transplant. And in some centers, especially the ones that do many, many transplants, the 5-year survival is more like 65%. It can be anywhere from 1 year to 15 years or longer, but the average, on average, is about 50% across the board.
I myself don't like that question because I don't like to limit myself, and I don't think that anybody should limit themselves. So to me, there is no life expectancy. Everybody has the same life expectancy because life happens, and you either go along with it, but just live it as much as you can. I don't like that question because I don't like to limit myself with my condition. I like to go out and experience everything I can and live my life.
So, James, knowing everything that you know now, would you do it again?
In a heartbeat. It was the best decision I've ever made in my life.
And how has that changed your life, if any?
I've been able to travel and meet new people through transplant, getting married, finishing school, having a life, attending transplant games. It's like an Olympic style event for people who have transplant. And just meeting new people through there and just living my life. And that's, I think, what every patient really wants. Nobody wants to be sick anymore. And the gift of transplant is just, it gives you that opportunity to just go out and, live your life to the fullest. And I think that's what every patient who's sick really wants. And transplant definitely gives you that opportunity.
Now, I've heard something about being a transplant mentor. James, do you know anything about this, or can you expand on it?
Yes, I've recently become a transplant mentor, and it's just a way for me to help other people who are in the process of deciding to get a transplant, or people who are actually on the list and waiting for their transplant, to help them, give them ideas on what to expect as a patient, because the doctors have their criteria of things they can tell you, but if they're not a patient, they don't have the fear and the apprehensiveness and all the questions that a patient's going to have. And the doctors do an amazing job in telling you, clinically what's going to happen step by step, but they can't tell you what's going on in your brain and how you feel. And that's kind of what I'm doing as a volunteer. I'm trying to help these people, this worked for me, this didn't work for me. These are things that I went over in my mind, and these are things that can help you. And it's just kind of something cool to give back to somebody else who's, in that struggle or having these questions, and make it easier for them in the future.
Definitely. So, last question for both of you. What is your advice for someone considering a lung transplant?
Well, I would say that get educated about the process. Get educated from your CF team, from the transplant team. There's information available, obviously, on the CF Foundation website, as well as the United Organ sharing website. So get educated, stay as healthy as you possibly can. Continue to do all your CF therapies, and get your family and your support team involved.
James?
I agree with everything. Just know that it is a gamble. There's a definite gamble on yes or no, but you have to decide what you want to do. If you want to live and enjoy your life with your family and your friends, then it's worth it. And for me, it was worth it, and I would do it again. All the struggles that I've had pre-transplant and post-transplant in my life before, I wouldn't change a thing because it got me to where I am today, and it's been worth it. And it's just living life to the fullest. And it's everybody has their own choice, but for me, I would do it again.
Thank you, Jennifer and James. For more information, you can go to the CF Foundation's website. Under Treatments, click on Lung Transplantation. Here you will find frequently asked questions about lung transplantation. At the bottom of the page, you will find additional resources as well as webcasts related to lung transplantation. Another resource is organdonor.gov. Click on the tab About Donation and Transplantation to learn more about organ donation and organ transplantation. This concludes the CF Foundation CF Education Day webcast, Lung Transplantation, the Patient Perspective. I want to thank James for sharing his personal story, Jennifer for giving some great medical advice, Rick Vasta and the technical crew, Leslie Hazel, Melissa Muller, Genentech, and the CF Foundation for making this webcast possible. Thank you.